Good afternoon, Joe. This is Andrew here from Group 8, Group Maelstrom Consulting. We're sorry to hear that you're snowed in this afternoon, but hopefully our presentation will lighten the mood slightly. So we're talking to you, as you know, the meeting is about us pitching to be selected as the group to do the National Children's Hospital Patient Record System project. So as you know, with the National Children's Hospital and Sligo Hospital joining forces to help combat paediatric illness in the 21st century, us here at Maelstrom Consultants believe that they also deserve a 21st century patient record system as well. So we're just going to tell you how we've split this up into different sections. Diagnosis, talking about what is needs to happen for the actual project. We have prognosis, which is our actual the benefits of what we're going to be doing. Treatment is our actual methodology for the project. Dr. Maelstrom's credentials are our group's specific credentials and why we're so good doing this project. And then cost of prescription is the costs that we're going to talk about, the cost structure. So firstly, I will talk to you about the symptoms. So what does the project require of us? What needs to be created? So we understand the system that the National Children's Hospital will need. It will have to have the ability to capture and secure patient records securely and store them, and allow staff from both Sligo and Dublin hospitals to access this information, to share it and to transfer patient information, and this information that is going to be saving children's lives, so it should be quite easy. And we believe it should be fully electronic and reduce any amount of time spent on filing by doctors and staff. By having it fully electronic, we can have a paperless hospitals, which will increase the efficiency of all involved and increase the amount of time doctors will be able to work on the patients, which I think we can all say is a good thing. Lastly, the system has to have a backup system integrated into it, with things like a disaster recovery element and a fault tolerance. It has to be an integral part of the system to make sure that specifically the patients, the children, don't suffer due to any sort of power outages or floods or staff mishandling of the system. So this is going to be an integral part, we aspire anyway. I'm going to pass you now on to Soumya, who's going to walk you through the next step.
Okay, so I'll be talking about prognosis. So that means the benefits. The first one is robust tendering process. The key products and services procured with a robust tendering process due to our attention to detail. And then we will do a cost control and we will implement reduction procedures and systems. And then we will do a communication protocols which will ensure that all the stakeholders are continually informed about the project status. And then we will also do the correct balance between innovation, content, functionality and security for the HSC. And then we will do a risk identification and mitigation plan before the implementation phase. Now I pass on to Nyan, who will talk about the treatment.
In our treatment path, it means how we can fulfill your needs. We understand that we are project managers, and our task is to manage other projects. To have you have an overview of what we will do, we will create a full plan, including WBS, project schedules, business case, a project quality plan, a risk management plan, a human resources plan, procurement plan, and cost management plan. Especially we focus on procurement plan. It means we will outsource the software for these projects. Based on your requirements, we will construct and build a requirements for the proposal for our suppliers of software, concerning software, and then we will decide which the best suppliers of suits your requirements for the hospital. This plan will help us to manage and to implement the projects on time and within budgets, and we will to make sure that we will focus on the fixed price baseline plans as you mentioned and required before. And now I will pass on Andrew to talk about our team.
Thank you very much. And so lastly, Joe, we're just going to tell you specifically why the Maelstrom Group here is perfectly set and perfectly able, much more so than every other group, in handling this particular project. As you well know, we have over 30 years experience between us 6 members working in major project management projects, including many state projects. But the significant thing is that we have experience in the medical research and medical and information system technology systems projects in the past. I'm sure you remember last year you sent us to Johns Hopkins University Hospital in the United States, where we worked with our sister company over there implementing a very similar patient record system for them. So we have plenty of experience implementing these sort of systems in a much larger scale in the United States, and we believe that this experience makes us a perfect match really to help the National Children's Hospital complete this project. So that is why we believe you should pick our group. Lastly, we hope that you aren't snowed in for too long and that we will see you Monday morning. Thank you very much, Joe.